Today I'd like to share an update on Isabella and her surgery on her eyes. It's called Strabismus Surgery. And I want to just talk about it real briefly in this quick update for Isabella. So Isabella was diagnosed with strabismus at an early age. Strabismus is a disorder in which the eyes don't look exactly in the same direction at the same time. And the cause of strabismus can include, nerve injury or dysfunction of the muscles controlling the eye. The main symptom, though, is they just don't look in the same direction at the same time. When it comes to strabismus, it can usually be corrected early on. Several treatment options include special eyewear, the use of an eye patch, as well as dilating the good eye to help the less good eye get stronger. When it comes to Isabella, we tried using the eye patch very unsuccessfully, I might add. It's hard for Isabella to understand the need to wear an eye patch. Next, we tried dilating her good eye to force her lazy eye to build up the muscle. This didn't work, and so her condition continued to get worse over time. The only option left was to have surgery to correct her eye position. In talking with other families who have the Trip12 deletion or mutation, I found that strabismus is common among these children and the procedure has been a huge help. So that was good to hear. It's not a permanent fix, though. Often these children need the procedure done several times as they grow older. Regardless of what the surgeon shared with us on the risks and the benefits of Isabella getting the surgery, as well as what friends and family had shared with their experiences, for me, I still had a lot of anxiety. I know Courtney did leading up to the surgery. I couldn't help but feel the angst over the possibility of something going wrong or Isabella's inability to understand the scope of what's happening. The day of the surgery, we were asked not to give Isabella any food for 12 hours and no drinks for 6 hours leading up to the procedure. This would have been manageable if they could do the procedure in the early morning, since most kids are not eating or drinking throughout the night. Unfortunately, Bella did not have her surgery until 4:50 p.m.
You can only have juice. You can't eat until 3 o'clock. Well, after that, you can't eat till after the doctor.
As you can imagine, any 5-year-old would have a hard time fasting 18 hours, let alone a special needs child who doesn't understand why. So here's Bella mid-afternoon, just emotionally distraught when we keep telling her no food, no drink. She just didn't understand. It was really hard for her. Once we got to Primary Children's Hospital, Isabella was mostly calm. Her brother Robert was really helpful in helping Bella feel comfortable. He even, on his own accord, wore Isabella's Trip12 t-shirt to show his support. He didn't want me to see the shirt, and he told Courtney that he didn't want me to make a big deal about it. I thought that was so precious and cute.
You're such a good brother.
Really just a good brother. When we got into the room, unfortunately, he or I did not get to stay with Isabella, just Courtney, due to this hospital policy where you can't have more than 2 people in the room. You can't have children in the room, which I think is just absolutely outrageous. What an outrageous policy for a children's hospital. But I digress. So Isabella's surgery went really well. The recovery was pretty hard to witness. Bella was in so much pain when she woke up, and she was confused about what just happened. And it was hard for her to understand that she couldn't touch her eyes, even though she was feeling so much pain. The doctor said it would feel like sandpaper's being rubbed on her eyes for a couple of days. That sounds just horrific for anybody, not just a child. And the recovery was really rough. She did not like having the IV or the pressure cup. or anything. She doesn't like anything on her body. And so she was in a lot of pain, and it was recommended either she take another painkiller and stay for a couple hours, or, you know, if we feel good enough to take her home, to take her home. And we knew that she'd feel much better taking all of the pressure cup off her arm, the IV, getting her out of her gown and into her normal clothes. And sure enough, that was just enough to help her feel a little bit more at ease, and we were able to take her home. So it was a good procedure overall, and we're looking forward to her full recovery. Really appreciate you watching this quick update on Isabella. Stay tuned for another update we're going to share in the coming week or two, and we'll keep you posted. Thanks for your support as always. And if you want to continue to support Isabella and her treatments and needs, please consider purchasing a shirt. There's a link in the description. All the proceeds go to Isabella's medical needs. So thank you for your time. Have a great day. Thanks for watching.